Laser Pulse is brought to you by BW Tech Medical, a leader in light-based devices for over 30 years. Whether you're a researcher or a manufacturer, we help turn ideas into reality. Learn more at www.bwtechmed.com.
Welcome, everybody, to the Laser Pulse podcast. This is where we discuss various aspects of the use of light in medicine. And today, our subject is shining a light on women's health. And our guest today is a true warrior in women's health. There's a long career as somebody who is not only committed to improving outcomes, but also destigmatizing some of the issues around pelvic pain, and that's Professor Georgine Lamvu. Brian, can you help us to get to know Professor Lamvu a little bit in some depth?
Sure. Thanks, Andy, and thanks, Dr. Lamvu, for joining us. It's a pleasure working with Dr. Lamvu over the last 5 years about. We've been looking at kind of laser applications for particularly pelvic floor pain, and she is truly a giant in the field. She's a professor at University of Central Florida. She is a director of the Fellowship in Advanced Minimally Invasive Surgery at the Orlando VA and the chairman of the board of the International Pelvic Floor Pain Society. She's published 50 plus papers on all conditions in women's health and focusing on, pelvic floor pain in general. So Georgine, thanks for joining us. You've had an interesting kind of journey, right? Being born in Romania. Kind of give us a feel like, how did you get to where you are now? A brief intro.
Thank you for inviting me to be here today. I actually am really looking forward to our discussion today. I'm a biracial child born to a Romanian mother and an African dad. I was raised in Romania for the first part of my life. And then we fled communism like everyone else. And then we moved all over the world. We lived in Africa for a while. Then my father passed away and my mother remarried. And she remarried an American. And so after living in several places around the world, I finally ended up in the United States. I came over for school and then just stayed. And my mother was an intensive care nurse, and my father was a physician, actually. And so I think I was kind of born to do medicine. I didn't really know that until I got to college, but I think it was just my mother is a very wonderful and empathetic person, and I got that from her for sure. So that's how I ended up here in this field.
That's great. And then you studied at Duke and UNC, all right, and before getting kind of into the specialty of urogynecology or gynecology.
Right. So I just want to make it clear, my blood runs Duke blue. No doubt about that. I'm grateful to both Duke and UNC for providing me the most outstanding education any human being could hope for, but I cheer for Duke when they're playing Carolina. Otherwise, I split my allegiance. So I went to Duke Medical School and undergraduate, and then I did my residency at UNC. And it was really at UNC where I developed really a fascination with a very complex topic in medicine, right? Chronic pelvic pain. I had a great mentor, John Stagey, who was I had two great mentors, John Stagey and Fred Howard, who are like the fathers of pelvic pain medicine in the United States. So they trained us to be inquisitive, to be forward thinking. I think the majority of the fellows that they trained are in this field, in pelvic pain and doing research, and we still work together to advance the field. So
Yeah, that's great. Give us an idea of pelvic floor, kind of for the people who aren't familiar, like I wasn't familiar 5 years ago.
Yeah.
Of really what pelvic floor pain is, how it presents itself, and what's kind of the current state.
Okay, so chronic pelvic pain, or pelvic pain in general, is pain below the umbilicus and above the thighs, front and back. So that whole region below the umbilicus is considered the pelvis. It is composed of muscles, vascular structures, fascia, and then the deep pelvic organs, or viscera, as we call them, the uterus, the bladder, the bowel, the ureters. And then the vagina is actually considered part of that pelvis. The ovaries, did I say that already?
No.
Both ovaries. So those are the organs that sit. The majority of the pelvis is actually taken up by the bowel. The uterus and the ovaries are quite small. But they all share a nerve supply. All of those organs are supported by the pelvic floor muscles. And what's really interesting about these pelvic floor muscles is that we use them every day. So when you're standing, walking, sitting, urinating, having a bowel movement, your pelvic floor muscles are in constant motion. So they're contracting and relaxing all day long, depending on what function they're fulfilling. And they also do that same contraction and relaxation during intercourse. So what we've noticed over the years is that when the pelvic floor muscles are not doing well, so they're not healthy for a variety of reasons, they tend to spasm. They become either rigid or flaccid, but they stop being able to function and do that contracting and relaxing at different points during the day. And when they are spasming or hypercontracted or hyperrelaxed, they tend to cause pain. And that pain is sharp. Sometimes it can be radiating. It can happen anywhere in the pelvis, upper pelvis, lower pelvis, right side, left side, you name it. Sometimes women feel it in the vagina, and sometimes even as far down as the rectum. And what is really, really taken us many years to figure this out, we used to think that chronic pelvic pain was caused by a singular condition, endometriosis, irritable bowel syndrome. But over the years, we've realized that these conditions tend to happen in the same patient, multiple conditions at the same time. So we would diagnose somebody with endometriosis and with IC and with chronic low back pain. And then it took us actually another decade to figure out that the common denominator to all of these conditions, painful conditions in the pelvis, were the pelvic floor muscles and the pelvic fascia. And so when, regardless of of what is the primary inciting factor that starts the pelvic pain, so let's say you have endometriosis, then the inflammation and sometimes multiple surgeries from endometriosis can really impact the pelvic floor muscles, and then the pelvic floor muscle spasm, and then you get worsening and more prolonged pain or sustained pain. So what we were noticing is that regardless of the primary cause, 80 to 90% of pelvic pain patients had pain that was either coming primarily from the pelvic floor muscles or being exacerbated by the pelvic floor muscle dysfunction. So it was the one common denominator to all pelvic pain conditions. And yes, that took us 2 decades to figure out. So that's what's really fascinating about the pelvis, right? Is that people are used to thinking about the pelvis in one organ at a time. Oh, it's my bladder that's causing me pain. Oh, it's my uterus that's causing me pain. But actually, in reality, it can be multiple organs. And most importantly, the thing that holds the organs together, which are the pelvic floor muscles.
Yeah, it's really fascinating, and an alarming rate of women and men have pelvic floor pain, right? It's a very high percentage of men, more percentage of women, right? It's more common. What's kind of the percentage of women that will experience pelvic floor pain?
Okay, are you sitting down? Because that number is really staggering, right? So we think the best data that we have right now, that about 25% of the world's female population is affected with chronic pelvic pain. And 80 to 90% of those patients will have a pelvic floor muscle problem. So in the United States, the prevalence of chronic pelvic pain is estimated somewhere around 24% or so of the population. Again, a quarter, right? Like if you take 10 women, you pull out 2 to 3, you're going to get somebody there who has pelvic pain. It's actually in the United States, chronic pelvic pain is more common than asthma, more common than diabetes, more common than breast cancer. And yet, and I don't know if you can imagine like being a diabetic, going to the doctor, and the doctor says, There's nothing I can do. I don't know what's going on, right? Like that's not something that we can perceive and imagine in modern medicine. And yet that's exactly what's happening to millions of these women. They go to the doctor and the majority of them are spending, if you look at the data, somewhere between 4 to 11 years in pain before someone can figure out a reasonable therapeutic approach to help them. And so a huge number, millions of women living with this chronic pelvic pain, the majority of them have a myofascial or muscular problem as either the perpetuator of the pain or the initiator of the pain. And we really, besides pelvic floor physical therapy, which, has its own limitations, we don't have much to offer patients. We do have some medications that can help just give temporary relief, but those medications are generally ineffective and they have quite a few side effects, right? Sedation, addiction, I mean, you name it. We have lots of problems with pharmacotherapy. So we're in desperate need to figure out ways of addressing, therapeutic ways that target the pelvic organs, the pelvic floor muscles in patients with chronic pain.
Yeah, so I guess that brings us to lasers, right? The laser applications. And you and I have met through Dr. Zipper, who Dr. Zipper and I co-founded Sola Pelvic Therapy. And Georgine has joined us as the chief science officer and running a very pivotal study right now. And we're basically come together and Dr. Zipper, being a urogynecologist, is deep into this field, certainly saw many, many women, like you said, 1 in 4 of his patients, or maybe more of his patients, because he's an expert also in pelvic floor pain, and came to me with the experience of using photobiomodulation for pain relief, and kind of went down the path of, yeah, I think we can get to these, pelvic muscles. Right? We've published a few papers on looking at some animal models and actually measuring how much light gets into each of these muscles, and then approaching Georgine, who the world expert. She's loved the sciences, maybe, right? You could give your own opinion, but I think that we've convinced you of, hey, this is compelling science. Let's look further. So what's been your journey kind of since looking at the data on photobiomodulation, and how can it potentially help?
Well, so, lasers are not new in medicine, right? I mean, we use them for lots of things, even in gynecology. We have CO2 lasers, YAG lasers, right, that we use for ablating vaginal tissue. But the big problem, and then we use surgical lasers in the OR, right, where we basically use a laser, a high intensity laser or high energy laser, like a scalpel, to cut and coagulate tissue. So lasers are not new to us. What is new, though, is how can we use lasers to help patients in pain? Because the traditional lasers that we've been using in medicine are ablative, right? I mean, they cause major tissue destruction. There's a process they cause pain, and there has to be a healing process that a patient goes through before they reap the benefits of the laser therapy. Well, obviously, if someone is in pain, we're not going to use a laser that's going to, or technology that's going to cause them more pain, number one. And then there's also the issue of if we use laser therapy in pelvic pain, it has to be able to target those deep pelvic organs and muscles, which we didn't have a way of doing that. So lasers are not new. We've been using them for a variety of different things in medicine for a long time, even in gynecology. And yet, if you talk to gynecologists about laser therapy, you'll get a range of believers, from believers to non-believers. You'll get the type of physician who you say the word laser and they just roll their eyes and say, "Oh, this is never going to work. It does too much tissue damage. We've tried it. The research is not good, etc." And then you'll get, people like me who are Trekkies and basically are like, "Where's my laser? Give it to me now," right? But we need to, if we're serious for a moment, the majority of gynecologists don't really know much about laser technology. They don't really know how it works. So lasers got a little bit of a bad rap in gynecology before we could even really figure out how to use them for the different types of conditions that we have in gynecology. So it took us a while to get here, and where we are now is we are starting to understand that there are different types of lasers, right? So we have the ablative lasers, the ones that we use for vulvar therapies, but we may be able to use different types of lasers for different types of painful conditions that are in the pelvis, and that's where photobiomodulation and low-level lasers come in. Now, the data that we have for, or the incentive that we have to use low-level lasers is huge, right? If we can make them work, so if the science is there to support it, which I think it is, then the benefit would be huge because it would be a type of therapy that we can use that's non-invasive, that could be accessible, right? And that is relatively easy to use on a large scale, which is pretty, I would say that is specific to non-ablative lasers, because the ablative lasers, we have to have highly trained individuals who do these therapies. We have to make sure we follow patients for adverse events, right? It gets a lot more complex. But with the low-level lasers, we get rid of a lot of that. And so we could make this therapy accessible. And guess what? The number, 1 and 2 problem of patients with chronic pelvic pain, the problem they have is accessing therapies. So a non-ablative laser, if we can make it work, would have huge implications in women's health, because it would enable us to treat a very, very common condition in a very, very non-invasive way, and we could make it accessible to a huge number of women, and maybe in the future even at home if we can, right? So the promise of this type of therapy, like it's just too much for you to ignore. Like we have to make it work somehow, which is what we're trying to figure out now. Now, will low-level lasers work to help patients with pelvic pain? Well, the science that we have indicates that it should, right? I mean, the way these types of lasers work, the wavelength that we use and the chromophores that we can trigger, right? We know that those chromophores, the downstream reactions that are activated by those chromophores have true physiologic effect. So they can, you can increase vascularization, decrease inflammation, provide pain relief, relax muscle, and relax muscle, which is the big one, right? So those effects have been shown for other chronic pain conditions, right? Neck pain, back pain, etc. And now we're just trying to figure out how to use that technology and apply it to the deep pelvis. And that's where SOLA comes in, because it's the only device that we know of that's developed that enables us to deliver this type of laser energy without causing tissue damage to the pelvic floor muscles. That was a lengthy way to answer that question.
Yeah, and there's you've been spearheading a very well-designed and large clinical trial called VOICE. Can you kind of give us what's that about? What's the status of it, and what are you hoping for as kind of endpoints?
Yeah, so VOICE is a triple-blind randomized control trial that we are conducting right now, looking at the efficacy of photobiomodulation or low-level laser energy compared to sham for the treatment of chronic pelvic pain specifically. We decided to do this study because we had observational uncontrolled data that we collected and published from community patients, from patients that were being seen in community practices, excuse me. And we had a lot of, hundreds of patients that we were following, and the observational data was so promising. And it showed us that, somewhere like 60 to 70% of patients who were treated with this type of therapy reported significant pain relief, not just a little bit of pain relief, but significant pain relief for even maybe as long as 6 months. And we hadn't seen data like that from any other chronic pelvic pain intervention. And so that data was promising enough that we said, okay, we have got to do the randomized trial to figure out if this effect is true against a placebo, because we all know that chronic pelvic pain studies have a huge, generally, there's a huge placebo effect from just about any intervention we try to study. So we had to test it against the placebo. Now, this trial is multi-center, which is very important. And it's all over the United States. So we have a really nice geographic distribution of patients. It's going to have enough numbers to allow us to look at the primary outcome of improved pain, average pain, percent of pain, patients who show clinically significant improvement, all sorts of ways that we're looking at pain improvement. But we're also going to look at quality of life and sexual function, adherence, satisfaction. So the trial is going to give us a lot of answers that we need, that we already had some hints about our outcomes from our observational data. So hopefully our trial will be just as positive. And then the trial is going to follow patients 3 months. And then again, we have an adverse event follow-up at 6 months. So far, we're about halfway through, which is amazing. We've had a huge response to this trial. And I've done a lot of research, and again, I don't want to jinx myself, but this has been probably the best trial I've done so far. And that takes a lot for me to say, because I'm usually a very pessimistic, data-driven kind of person. I don't believe anything until the data shows it to me. But anyways, this trial has been really positive, and it's a testament to how much this therapy is needed. Like women, we usually have a hard time recruiting patients for studies, right? But we're recruiting them at phenomenal rates because women don't have another treatment alternative. And so they are really motivated to help us figure out whether this non-invasive and easily accessible therapy is going to help them. So we're at about the halfway point right now. We won't, it's a fully randomized, fully triple blinded, so we won't know who's in what arm until the study is done. But it's going it's going well enough that we are hoping to have our results by the end of the year, which is unheard of.
Yeah, that's great. There's a massive need. Are you seeing, it seems kind of from general medicine and publications and maybe social media, that femtech and women's health is gaining momentum, right? There's more people talking about it. I mean, it seems to be that education is a big part of this, right? To educate patients, to ask their doctors, ask their gynecologists, really to get that access. Are you seeing that trend, and maybe why the study's going well? People are kind of in tune with, hey, this is a problem that I need to go talk to my doctor about.
Yes, a huge trend towards including women in research and innovation and technology. Absolutely. When I started in this field, and I won't tell you how many years ago because I don't want to show you give away my age, but I'll tell you this, it was well over 20 years ago. So when I started in this field, we could barely get people to acknowledge the problem of chronic pelvic pain. It's not that it wasn't there. It's been
Right.
a major problem for hundreds of years, but we could barely get people. And when I say people, I mean clinicians, I mean investigators, I mean business people who are investing in these technologies. We could barely register on their radar. And that was really, I mean, it was very disappointing is not even enough of a word to describe how sad that used to make me, because I was in clinic taking care of the patients and seeing the pain and the desperation and the, lack of hope. And I was seeing that from the patient side. And no matter how hard we tried to help the patient, we just didn't have anyone who was helping us innovate and create technologies and therapies. And so thankfully, over the last 20 years, that has changed dramatically. And, what I have to say is it's about damn time that folks figure out that women's health is a huge field that needs to be addressed. Um, and I think that it's great that it's not just in the medical field that we're realizing that we have to take care of these patients, but also people are investing in businesses that are developing these technologies. And that's really key, because without investment and support from our scientists and our business folks, we can't make any headway. And then we're leaving a significant proportion of the population without health options. And I just want to point out that that proportion is the proportion of the population that's taking care of families, that's having to go into the workforce, right? And providing all sorts of services that they can't provide if they're in pain.
Yeah, and IPPS is a great organization, right, for people that want to learn more, get more training, right? I know you were involved for a long time with IPPS, which is the International Pelvic Floor Pain Society. Tell us what the kind of mission is there and how people could get involved.
So the IPPS, which is the International Pelvic Pain Society, has been around since 1996. And the primary mission has been to educate healthcare professionals about the problem of chronic pelvic pain. And what's key about the IPPS is that the problem of chronic pelvic pain is often multifactorial. So it takes multiple specialists working together to help the same patient. And so our mission, our primary mission, is of education, meaning we want to make sure that clinicians and healthcare providers, professionals, learn how to manage pelvic pain, right? So that they're not turning away patients when they come to the office. So that's the primary mission. But it's also, we have secondary missions. It's a mission of networking, right? Making sure that all these clinicians work together. There's a mission of educating patients, because patients have to learn how complex pelvic pain is, that we don't just have one cure, that it takes multiple disciplines and interventions to make you better. And then over the years, we've progressed to add the mission of research and advancing therapies, and improving access. So those are the, multi-pronged. It's educations for clinicians and patients. It's networking and collaborating, improving research, and improving access.
Yeah, it's a great society. I've been to the meeting a couple of times. I think I gave a talk there a few years ago about photobiomodulation to get more people interested. And it's also a good venue with physical therapists and physicians. I think it's very inclusive of the medical field that nurses are getting involved. So it's a really good place for education and like you said, networking, because I've seen, certainly it takes many specialties, right? There's potentially a psychological component. There's a lot of components for pain patients in general. And I think that having that well-rounded approach gets better outcomes.
Yeah, absolutely. That's what we're working towards.
Yeah, it's great. Yeah, well, thank you. One last thing. Let's talk about the future.
Yeah.
Where do you see the future, the trends for innovation, whether it be lasers or not lasers, but in your field of expertise, what excites you about what's coming?
Well, so a couple of things. I'll start with lasers. Um, I think that I would love to see laser therapy that can be widely accessible, whether it's in an office setting or in a clinic or a home setting, right? Like I really, in my Star Trek mind, I see the day when come home at the end of the day after I've been operating for 8 hours, and, the pelvis is on fire and you can just use your laser therapy at home. That's my ideal, right? But and the other thing is, at an acceptable cost. So there's access and there's cost and things like insurance coverage and so forth. So I think that's where lasers need to move to. We need to make sure that they're usable in the pelvis, right, for women. So in a way, they're going to be gender specific, and then to be able to use those lasers in multiple settings with, different wavelengths doing different things, right? Because we know that's how lasers work. The other thing that I would love to see is, how can we, so there's a lot of improvement. We need, that we need to do to make. So we need better diagnostics, right? Like we need ways of better imaging the pelvis and the conditions in the pelvis that we cannot see, right? like endometriosis, for example, there's got to be more technology invested in imaging, targeting the nodules of endometriosis that implant throughout the pelvis. There's got to be a way to target. I think for me, what would excite me a lot is if we could have, because we know that a lot of these conditions in the pelvis are mediated by the immune system and they're inflammatory conditions, basically. And so it would be very nice if we could start moving towards therapies that deliver these target anti-inflammatory molecules to the specific pelvic organs so that we can bypass intravenous or oral medications, pharmacotherapy, because pharmacotherapy has a lot of unwanted side effects for our patients. And so, I mean, that's what really excites me about laser therapy is that we can use this technology to initiate a chemical reaction in the body without pharmacotherapy, which is huge. Like I can't think of anything else that excites me more, really, honestly. So that's what I see in the future.
Yeah, that's great. I know there are some pretty interesting things going on with targeting, right, inflammation or targeting endometriosis, some with light, some without light, but it is a very interesting field and a huge need, right? I think that the exploratory surgery and not only the invasiveness, but the cost, right, and the accessibility. I think that if we can get something less invasive and more diagnostic is definitely an area that there's a big need. So hopefully you could do some research on that for us and
Yeah.
again when that gets going. So last thing we ask all our guests to kind of close is what brings you joy, whether it's professional, personal, like what, Dr. Lamvu sitting down on a Saturday and it's joyful. What does that look like?
The things that bring me joy, and I would say me and my family, because if I have any spare time, I usually spend it with my family. But traveling is one of those things, reading, but traveling and getting and meeting, people from all over the world, that's one of those things that brings me joy. And then writing, I like to write a lot. I know this is really kind of nerdy, but research. I really like research. It brings me joy to like have a problem and then kind of dive into it and figure out a way of collecting data. I really can get lost in that world quite a bit.
Yeah, that's great. And we have working with you over the past couple of years. I really that brings me joy that you love love the data and love it so clean because then when I look at it, I know it's been scrubbed and it's not just a bunch of mess. You're very detailed and a fantastic researcher, a fantastic doctor, and someone I'm proud to call a friend. So
Thank you.
it's been great. Thank you for joining us.
You too.
Andy, you have any closing comments for us?
Yeah, so it's just so refreshing to hear your approach. And we spent, 15 years with the largest laser company in PBM, and we rarely heard about about pelvic pain. We had one Swedish researcher who was engaged in it. And yeah, we were at pain meetings, we were at all sorts of meetings, and it just never came up until Dr. Zipper approached Ralph. So I think it's your voice as somebody who's really dedicated to destigmatizing this. So women are comfortable talking about it and doctors don't want to shy away from it. It is, I think, a really beautiful thing that's happening as there's more focus on women's health. I mean,
And
years
one
ago it was the wandering uterus, right? That was caused
right.
hysteria. That was women were crazy when they had pain. So I think I think your work and the work of groups like IPPS is bringing a lot of light into that destigmatization, if that's a word.
And I do want to emphasize that pelvic pain affects men too, and they're just as stigmatized as women are.
Right.
Men don't talk about pelvic pain. And if they go to, they sure as hell are not going to talk about pelvic pain with their friends. And if they go to the doctor, most doctors actually don't know how to deal with male pelvic pain. So that's a whole this, the fact that women pelvic pain got attention first in this field, in medicine, is actually quite astonishing, right? Because women are always an afterthought. But um, I want to make sure that we don't forget the men, because God only knows, and I'm not a particular religious person, by the way, but really, we do not know how many men are out there living in silence with this type of pain.
Right.
But I'm willing to bet that the numbers are not small, and I'm willing to bet that we share a lot of course, the same pathophysiology. And I think that, I think it's important to point out that it's a lot about women, but it's not only about women.
Right. No, that's a great point. Our subject today was light on women's health, but it's wonderful that you make it all encompassing because it's a critical issue that is still seems to be somewhat in the darkness. So bringing light is great. I know that IPPS people can get more information there, and it's pelvicpain.org. Right. So if anybody has any questions or concerns, they can write to info@aimler.org. If anybody would like to suggest a speaker or a topic, we would welcome that. And I would just like to close by thanking BW Tech Med for sponsoring this, for Aimler for promoting it, and thanking Georgine for her time and wisdom that she shared today. Thanks, everybody.
Thank you.